Hello and welcome. My name is Zafar Iqbal, and you're watching the Mojo story. On Monday, a milestone was achieved by India when 1 crore COVID vaccines were administered for the third time in 11 days. Prime Minister Narendra Modi also tweeted about it. It's the world's largest vaccination program that's underway in the country. Close to 70 crore COVID vaccines have been administered so far. Now, with the vaccination drive going on at this pace, well, is there a chance that it would actually limit the chances of a third wave, which is most likely, according to some reports, going to hit in the month of October? That's what we will be talking about. We are joined by a panel of experts who will discuss the issue. But before that, would also want to point out to some other details. India has administered a record 180 million doses in the month of August. Now, this is more than all the G7 nations put together during this month. That is according to the government figures. Now, India is at the moment reporting more than 42,000 fresh cases in a day, while Kerala contributes to most of those cases, about 30,000 cases. Now, to discuss about this entire issue, we're joined by Dr. Ishwar Gilada, we're joined by Vineeta Bal, Dr. R.K. Mani, and Ranjana Kumari. Starting with you, of course, Dr. Ishwar Gilada, if I may, with the vaccination drive going on at this pace, we have been administering 1 crore vaccines in a day, for at least for 3 days in the last 11 days. Do you think we are right on the mark to actually prevent and counter the third wave?
Actually speaking, India has a capability to administer not 1 crore but up to 3 crore a day. India has a capacity to produce that many doses. What is worrying me is the inconsistency. If on one day we can administer 1 crore, why on the other day it is only 20 lakh? Like you look at Sunday. Uh, I have been telling from the very beginning of the pandemic or very beginning of the vaccination that we should have 24 by 7 vaccination. If you say pandemic, if you are doing lockdown, if you are having a lot of constraint situation, what is it stopping us to have a 24 by 7 vaccination? Secondly, why less vaccination or no vaccination on Sunday? Thirdly, you should have a dosage a chart ready that for this next week, so many doses are there, and you can stagger them in 7 days. You can't have today you are giving 1 crore, tomorrow vaccination center बंद है, vaccine उपलब्ध नहीं है. So this kind of strategy, vaccine hesitancy, there are people who are totally hesitant. Whatever you do, they will not take. But there is a marginal hesitancy of people who are fence sitters. And when the epidemic or pandemic is on waning side, then the people are not very keen to take vaccine, or they don't want to go to vaccination center twice or thrice or 4 times or wait there. So if you make it available on Sunday, if you make it available at all doctors' clinics, at nursing homes, so that people can go in the vicinity of their walk and they will take vaccine and come back. They should have to spend their time, bunk their duty, because you are giving vaccine free. But if a person who is earning 500 to 1000 rupees a day, and if he has to waste a day for a vaccine, then the person will be hesitant to go there. So this hesitancy is relative hesitancy. So we need to look at this, and we really salute the vaccine manufacturers. They have shown to the world that we have capability to produce. Secondly, by the end of this month, we'll have more and more vaccine available. Biological E, which is approved already, they will start rolling out their vaccine. Government of India has already pre-purchased 30 crore vaccines from Biological E. Zydus Cadila, they are licensed. They might also start rolling out from this month end. So we'll have enough of vaccines available. Currently also there are 3 vaccines available in market, but Sputnik V is hardly anything. This is not even 0.5% of total vaccine rollout. So we talk about only Covishield and Covaxin, which is almost 90%, 10%. So Covaxin percentage will increase, but it will never compete with Covishield. So we should look at all these issues, and it is possible that we can complete vaccination before end of this year.
Dr. Mani, by now things should have been streamlined, but why is it that on one particular day we have 1 crore vaccines and on some other days the number is much lesser? Though, according to the government figures, 180 million doses were administered in the month of August, which is more than the combined number of doses administered by the G7 countries, nations put together. Why is such a big difference there?
I think I agree with Ishwar Gilada that we have to be consistent. We can take heart from the fact that huge numbers have been vaccinated, but we have to see the denominator. What's our target? So our numbers should match with our goals and targets. Now, 1 crore for 3 days out of 11 days should have read 1 crore every day for 11 days. If you have to meet the targets, because there's a huge vulnerable population still out there, who have neither got infected nor have they received the vaccination. So long as there's a large number, in absolute numbers, population which are as yet unexposed, we are going to be vulnerable to a third wave. And we are also going to be vulnerable to a new mutant of concern emerging if we don't watch out. So I think the first goal is to ramp up the vaccination rate as much as we can get, and not look at the total number, look at the proportion we are vaccinating. And we have seen that in UK and USA, in spite of a large population getting vaccinated, upward of 50%, now close to 70 odd percent, even then, their numbers are growing and they are high. And what we can take heart from is the serious illnesses and the mortality is low, as we had anticipated. That the infection may not go down. We have seen in Kerala experience also. Infection is very high. The mortality is really low. It's only 0.4%. It's lower than rest of the country. So what does it show? If we don't want our infrastructure to be, challenged, and if we don't want serious consequences of the disease, we must vaccinate first up. And we should not say that there is a problem with hesitancy. Now, more than the number of people hesitant, people are eager to get vaccinated. That's how we are able to achieve targets of 1 crore and 1 crore plus. If there's a hesitancy on a large scale, this couldn't have happened. I must say, we should think of the worst, that if we don't vaccinate enough, we are vulnerable to third wave, and work from there.
Dr. Vineeta Bal, more than 42,000 cases across the country and 30,000 of them from Kerala. That's on one hand, those are the figures. And on the other hand, the vaccination drive that's picking up, and there are days 1 crore doses are administered. Do you think that we are right on the way to counter the third wave, or much more needs to be done? By now, we should have learned our lessons and streamlined the whole system.
Yes, we should have streamlined the whole system. As the earlier speakers, Dr. Gilada and Dr. Rajkumar Mani said, that even if we ramp up or go to a crore and plus doses, within the next month, 2, 3, 4 months, and especially since the so-called experts are predicting a third wave in October, before October, there is no possibility that we will cover all the eligible population even with the first dose. So there will be susceptible population which will remain. And I suspect Kerala case is somewhat different as compared to many other states, including Maharashtra, where in second wave or in the first wave, there were very large numbers of people who were getting infected, hospitalized, and so on. Kerala managed to have is what everybody calls as flattening of the curve from the very beginning. As a result, their seropositivity rates are low, But now that the rest of the country is showing much lower rates because of higher seropositivity and higher susceptibility that they encountered during the second wave, Kerala is now more or less steady at a level, so that the 20,000 plus minus cases that we are seeing, they are essentially catching up. Their seropositivity, Kerala seropositivity will go up with this. And as again we heard, their mortality, the death rate is very low. So infection is high, death rate is very low. So again, they are probably not going to encounter third wave if they continue like this, because the vaccination seems to be taking place there also pretty effectively, as much as it is possible.
Yes, of course, those are the details about Kerala and the rest of the country. But also, what is important is that schools have opened up in some places like Delhi, of course, with 50% attendance. That's being talked about. Uh, you know, whether it's the time to open the schools, not just in Delhi, but other places also. Of course, there are systems put in place. But do you think that that we are prepared to reopen the schools in the country? It's been quite a long time since the schools are closed.
I think we will never be 100% prepared.
Yeah.
Every preparation will have its own problems. But I
Mm,
think it is really, really high time we should start schools for two different
mm,
reasons. One is that we do need to worry about mental and physical health of children who have been out of school for more than 1 year. And especially the underprivileged kids are also not getting their midday meals, and they don't have smartphones. So they are the ones who are really, really deprived and do need to come in. Their parents are not so apprehensive, I gather, to send them to the school. And as long as all the adults in the school at least have one shot, if not two, meaning meaning teachers and the others adults, then we should start the school. If for whatever reason, if elite parents, and I am making this point, as elite parents do worry about their kids a lot more, show apprehension and don't want to send them to school, if even if there is a minor risk of their contracting, they can remain online because they have access to smartphones, don't have to worry about it. And in any case, we know that the illness in kids has never been as serious as it has been from 18 and above. More the age, worse is the age disease. So I think school should open as soon as possible, slowly and steadily, and within next 2-3 weeks, I think more or less all over the country, all schools should open, because the vaccination would have had its impact by then on the teachers especially.
Yes, there was a survey actually carried by the Indian Express. It said that many people, many children are leaving the schools in rural areas. That's a big percentage of them. They are not able to attend their online classes, and a big chunk of students is turning from private schools to the government schools. Dr. Ranjana Kumari, if I can ask the same question to you about the opening of the school. Do you think it's time to open the schools, or we may need to wait for some more months? Because, of course, the teachers can get vaccinated, the staff can get vaccinated, but children aren't vaccinated just now.
I think, there are two issues and two aspects to this question. One is that, I want to draw your attention.
Oh, we seem to have. The line seems to have got disconnected. Well, if I can ask you, Dr. Mani, the same question, do you think that it's been a pretty long time, and now perhaps it's time to open the schools?
I think so too, because actually, as Dr. Bal says, there is a lot of attention to be drawn to the mental health and the development of children. And this time will pass quickly and they will be denied an opportunity, especially the vulnerable sections of the population, for the reason that they do not have access to the smartphones or online classes. They don't have access to midday meal and nutrition.
Yeah. Yeah.
So and their susceptibility to serious infection is low. So I think we must sort of take that into account. We have seen statistics available now in the last nearly 2 years. Children are not don't seem to be affected in a big way. Of course, they can infect the adult population at home. They can carry the infection. However, on balance, I think while the COVID precautions are in place, children should be there in their schools.
But I want to understand, Dr. Mani, since children are not vaccinated, don't you think it's be putting them in risk? Of course, the staff members can be vaccinated, but just the fact that they are not susceptible to infection, is that enough? Or we should wait to get them vaccinated first and then perhaps open up the schools.
Oh, it's there is a problem because there is a relative scarcity. We must first
Yeah,
focus on the more vulnerable population, and we haven't done that. Therefore, to divert vaccines to the children is not opportune at this moment, and also to
yeah,
postpone their getting back to schools is not wise, I think. On balance, we have to take the best of what we can, vaccinate the adult population as quickly as possible, and those children who, for reasons of comorbidity, are vulnerable, we
yeah.
should focus on them as well, and at the same time, keep the COVID precautions in place
Yeah.
and make sure that we observe them.
Yeah. Dr. Gilada, you want to add something to this?
Yeah, I would like to add one thing that if the zero prevalence in the country in 4-0 survey is around
Yeah,
67%, that includes children, and that is include the children means they have a 0 to 10, 10 to 20. In that group
yeah,
also it is around 60-65% positivity. So what you need to do is very simple. All the school staff, including teachers, should be vaccinated. Number two,
yeah,
you do one drop blood test among children. Though if they test positive for IgG, they have been already exposed. They have been already having immunity. Let them attend the
yeah,
school. Among those which are testing negative, give a choice to parents that your child is COVID uninfected, may be
yeah,
exposed. Do you want the child online or offline? By that way, we have at least two-thirds of the children available in the school. Secondly, you stagger hours of the schooling. You can have school into like online also they are doing only 1.5 hour or 2 hour. You keep
mm,
both hybrid model like we are doing conferences online and offline both. You do hybrid model. Thirdly, you
mm,
stagger the hours. You can have morning shift and evening shift so that your school attendance is staggered. A lot of parents may not send, but there is a survey published in Mumbai today which says that 97% of the parents are willing to send the children to school. So if 97% of them can give a written consent, why is so much hesitancy of opening of the school? You can have religious ceremonies, you can have Ganesh festival, you can have all programs, but you cannot open the school. So this dichotomy is without understanding.
Dr. Vineeta Bal, you want to say something on this?
Yes, I wanted to add a point that in addition to what both the speakers have said, there is
Yeah,
another technical point. Today, practically no vaccine available in India has been tested and approved even for emergency use in children. So 12 to 18 is one category. Of course, the clinical trials are going on. And I personally feel there is no serious risk involved if children are vaccinated. But unless there are enough data available, this cannot be a public health recommendation. And that's an additional point to say that do not wait for children to get vaccinated, but start their schools as early as possible. I
well,
just
we got
wanted to add that. Yes.
yeah, we got Ranjana Kumari back. We lost her line. We're talking about the opening of schools. It's been opened in Delhi. Of course, there are SOPs in place in other places also, with 50% attendance. Uh, Given the fact the vaccination drive is also going on, children are not vaccinated, the staff members are vaccinated. Do you think it's perhaps the time to open up the schools? Also, keeping in view that many students are not having access to internet and smartphones, particularly in rural areas.
Yes, sorry, my line was not good, so I had to drop out. But I just wanted to bring a different aspect to this discussion, and especially about school and children going to school. One is that, as you already, we are all aware of it, there is a gender gap in terms of vaccination. Not only that,
Yeah.
because of the vaccine hesitancy, but also social norms. There are so many different
Yeah.
kinds of misinformation which has created
Mm.
this hesitancy, and also that that pregnant women cannot get vaccinated, or elderly women should not, or women's possibility of getting pregnant, and also it will disrupt the menstruation cycle. So many things, because we are working with Asha and Anganwadi workers in a very extensive way in Haryana, Delhi, UP, many states. So we have realized that unless women are vaccinated, that is mothers are vaccinated fully, this pandemic has taught us one very very single lesson, that is nobody will be spared. So if nobody is spared, whether it is the different in terms of caste, in terms of gender, in terms of class category of people, then I think women will have to be brought along. I mean, they must be. Mother is not safe, and sending the child to the school can really create a lot of crisis inside the homes. And secondly, it's not the question of government school children and their parents willing to send the child and child is missing, but it is the government schools which are most ill-equipped in terms of hosting these students. Fancy schools have managed to create 6 feet distance. They have managed to create, children will go from one side of the steps. I have read the whole detail protocol for the vaccine, for the schools to start. Many arrangements have been made that one-third children can come at one point of time. So many things. But schools which have less infrastructure, especially imagine school which does not even have proper toilets for all the children, and especially girl children, and then you want to bring and crowd the schools. And don't forget, the main peak of the second wave was in March, April. First March, April, May, we suffered, and then again March, April, May. That whatever they may be saying October, doctors are saying October, November. But I have a feeling that it may get extended, and then when we get the real peak, and as the medical doctors are here, they can tell about what is going to happen to children. If 7,000 children in a state in US are hospitalized, then I think we need to really worry about that, because our child care infrastructure is extremely lax, extremely. I mean, we don't have enough facilities, we don't have enough, in case there is need for any kind of oxygen, all those issues will come up again. So I think there is no rush. If we can, we should try to equip children with technology. That should be the effort. We should try to reach out to as many children as possible, and maybe groups of children can sit in the panchayat house and things like those to be able to access the education. But if you want to push the children to go to school at this stage, a lot of parents are not willing to do that. I mean, I don't know, I won't be surprised that there were schools, I went through the data, parents, only 8% parents agreed to send the children to school. So parents are really worried, and in case children fall sick, then both parents are working at the moment, mother, father, both of them are working, whether it is the labor class, because economy of the family has gone down so badly that every able hand has to work. There is no money in the house, so
Yeah.
every able hand has to work. Mother will work, father, the other elderly, who's going to look after the children, sick children? So I think it's very important to make a holistic approach. We are always looking at one side of the picture. The children have, in
Yeah.
any case, children have lost 1.5 years. In any case, children have been sitting at home. We are managing, we are coping up. But imagine, in India, this pandemic is going to reach a large number of children. What are the parents going to do? How are they going to cope up? And if adult could not survive, so many adults could not survive. I mean, children, they are so vulnerable. They are so. And can you imagine a child keeping 8 hours of mask, wearing a mask? I think we must be fooling ourselves by thinking the children will be able to wear masks. There'll be such a struggle between teachers and the children in the school. The children will soon start hating the school. I have visited a school where they have 4 wash basin to wash hands. 2 of them are closed, so only 2 will be functional. There are 4 toilets, 2 will be closed, only 2 toilets will be functional. 800 students are going to come to that school. I mean, let's really look at the realistic picture of what our country is prepared in terms of health infrastructure, in terms of school infrastructure, in terms of teachers being vaccinated. Have we ensured that every PN, driver, gate person, and in government school they are not there. There are no chowkidars, there are no PN, and everybody is vaccinated, double vaccinated. No, we are only 17% people in the country who are vaccinated with both vaccines. and rest of them are only one vaccine. And as doctors said very rightly, that why it is that is such inconsistency. 1 crore one day, we take a great pride in, look how efficient our infrastructure is. The other day, you have hardly vaccines available, or very few centers are open. You go to the center and center is closed. There is no vaccination available. Forget about any other state. Look at Delhi state. This is the same story here. And in UP, I belong to UP from Varanasi, and I can tell you that vaccination drive is going very well. I am very
Uh,
happy
uh,
about that, but really not
it's a
properly.
it's a very
Please
it's a very
don't
important
rush into opening the school. That's my
it's
idea of
it's a
how to
very
do this kind
important
of a thing.
it's a very important viewpoint that of course strong views that it's not the time to open the schools. Of course, we need not to experiment, and uh, we need to vaccinate the staff members totally, and then we can further look on taking it to you, Dr. Gilada. Do you think we're medically prepared for schools to reopen? Suppose the schools reopen and there is an emergency, do we have the infrastructure in place, or will be still caught off guards, God forbid, if such an eventuality comes up?
Zafar Saab, understand two things. One is the third wave is not going to be stronger than second wave in any circumstances, because we have a mix of population. We have partially infected population and partially vaccinated population. Secondly, as Ranjana ji has been saying, that children are at home and parents are working. So if children are at home, they are not able to go to school, then the parents have anyway have to be at school for online schooling. My daughter, who is a doctor, she has to sit at home for 6 hours for the children online education. So
Yeah.
this is a problem. Secondly, even if the children are not gone to school, how come 60-70% of them are infected? So school is not the reason for they getting infection. So I think we are overblowing this, that by going to school they will be infected. We are inflicting some infection on them. Their CFR or case fatality rate is 10 times lower than the adult population. So CFR is not there. Our problem is that we are knee-jerkism. When we want to open the school, then we realize that teachers are not vaccinated. Russia has given first priority to teachers for vaccination, like India has given first priority to doctors. We could have given at least second or third priority to teachers and school staff. We have not done that. And that is the reason that we are suffering today. So today, there is no second thought that school should be opened. We are prepared medically. There are enough of hospitals, enough of doctors. Children, even if they get infected, they will not land up in hospital. Even if they land up in hospital, they will not be serious enough and they will not be dying. So don't worry about that. Now, the second issue is that children can bring infection to uninfected parents, or from parents to the teachers. So that is possible. But again, when the parents are vaccinated, when the teachers are vaccinated, even if they get infection from any of the new waves, that infection will not be serious enough. That infection will be just positivity, but no severe illness, no hospitalization, no deaths, or very less deaths. So I think in this kind of scenario, we are well prepared medically. We are well prepared vaccine-wise to adult population. We should think of the different strategy. We should not think of the same thing. We should think out of the box. That we 1.5 year we are sitting idly. We should have thought of what are the other ways. Can we how do we open the school? Can we have a school for morning, afternoon, evening, 4 hours different? Can we have a school on also Sunday, Saturdays? So schools are only 5 days. If you stagger that to 7 days, you make a two shift. You already have half of the population. So I think we should think of all
Strong,
those strategies, and we should do a
obviously,
brainstorming session in
that
eligible
is
people. And so long as
that
parents are willing to send, don't stop.
that's very important, that we need to do planning. I think right from the outset, if at all something is missing, is clear planning about the whole thing. But of course, strongly defending the opening of schools, whosoever makes the decision at the end of the day, it's not an easy decision to make. That's quite clear. But Ranjana ji, you made an important mention of the gender gap in vaccination. I would like to read out some points about that. Nationally, more than 69 crore doses have been administered. 52.3% vaccine doses are among men, 47.1% vaccine doses among women. Now, in Delhi, 57.8% among men, 42% among women. In J&K, 56.5% among men and 43.4% among women. So basically, Delhi and J&K have the worst gender gap. It is another issue that has perhaps missed the eye and need to be looked at. That why is it that one particular gender is being administered less vaccines compared to the other? Ranjana ji, if you can further elaborate.
Yes, I think it's important to look at the data and which category of women who are not coming forward. One is the elderly
Yeah,
women are not coming forward,
yeah,
and the other category is the reproductive age women have not come forward. So, reproductive age because of the misinformation that if you will get vaccinated, first of all, pregnant women should not get vaccinated. So that was a very very prevalent thing that we had to deal with when we were working with ASHA workers and Anganwadi workers. Now the other thing which is very important is the elderly women. Now because it is something which has to do with technology friendly people. If the men are entering their own data, and then there is a possibility of entering four more people along with the person who wants to go for vaccination, then why it is that they are only the man and the son? So many families we have interviewed where we only found that the man has got vaccinated and the boys have got vaccinated, but not the wife and the daughter. Now why it is like this? Because that women themselves are not very careful about their health. Family doesn't really take responsibility of women's health, and also that there is this misinformation which is there. So that is creating further gender gap in terms of women coming forward. Now here is a responsibility of the machinery, the government machinery, the government, and people who are really in the whole administration of vaccination. So what they need to do is at least to ensure that when a man comes for vaccination, they can ask, what about the wife? What about the daughters? I mean, there is nothing. Men are just lining up for vaccination and taking the vaccination and going back home. But nobody is asking this question, where are women? Why are they not coming? In a state like Delhi, they are not asking this question. So I would say that somehow we have to create. There is a technology where you enter your data, you get your time,
yeah.
you block a date for your vaccination, and also walk-in vaccinations are there. So there is need at two levels. Level one, that the, the administration which is really pushing the vaccination should start with the campaign that every woman needs to be vaccinated. Everybody, every individual, including all the women. And when they are going for vaccination, they should ask this question: why women are not coming? Why your wife is not here, or why mother is not there? Mostly elderly women are not going for this vaccination. Imagine how much risk they will run if this third wave comes and they again get infected. We have already lost a lot of our elderly, and if we will not take care of this in the third wave, then whatever milder the wave will be, nobody falling sick even for 2 days. If a child or an elderly falls sick, there's a lot of responsibility that is on the family. There's a lot of stress, and then of course the economic loss, because we have to spend so much money for medicine,
Yeah.
for whatever hospitalization, and none of them are insured. So if there is no health insurance for elderly, because after 60 you can't really insure if in a normal way. You really have to go
So,
for a very expensive insurance. So a lot of people are not even insured. So where is all this money going to come from? I would
so
say
if
that
I,
there has to
yeah.
be insistent on bridging this gender gap in terms of vaccination. At least this lesson we should learn from this pandemic, that every
Dr.
man and
Gilada
woman is
wants
equally
to come
important.
in. Dr. Gilada, this
Yeah,
gender gap in vaccination.
Ranjana ji was rightly saying that from this pandemic we are learning a lot of things. What I learned and what I have seen from my childhood, that women are no less than healthcare workers. They should have been given the category of healthcare workers so they get a first priority for vaccination. Number one. Number two, if you look at any parameter, whether you look at HIV, tuberculosis, any other diseases, women are less important from the point of view of treatment. So wherever there is a 5, 10%, 8% gap, and that is wrong. So COVID has shown that this kind of gap exists. That gap should not have been existed. And thirdly, if you look at the percentage of people getting infected, also men were more than female. So men were more prone to get or easy to get to injections. Secondly, in comorbidity, men are more than female. In all kind of precautions, I think female are better than men. You see any kind of place where masking is there, female are more honest than men. So I think that also plays a role, but they can be considered as healthcare workers. That anybody sick at home, men don't care, women care.
Dr. Mani, again, we've been learning many things in the course of this pandemic. When it started, there was hardly any knowledge, and now we come to the point where the data shows that there is gender gap in vaccination. What is the possible reason, and what can be done to really change that?
See, as Ishwar Gilada said, there's been gender gap in the management or treatment of most diseases, okay, which are common to both genders. There is this gender gap. The number of patients who come to hospitals, for instance. There's always a gender gap. Males outnumber females. Of course, there are some diseases which are skewed against the male gender. Like trauma. Trauma is far more in male gender, and most of the cardiovascular diseases in the middle age and the younger age is skewed against the male gender. I think there is a lot of social conditioning involved in this. There is a greater attention to men's health, is greater protection for the male gender right from the childhood. So I think there is a lot of social conditioning involved in this. Of course, as Ranjana said, there are other issues like people have been being misinformed about vaccination in the reproductive age group, for instance, and in pregnancy. But I think what the overriding factor here is the social conditioning. In that has to be, the awareness level has to be raised there. I must add one more point, Zafar, if you permit me.
Yeah,
Now,
sure.
we have been thinking that the third wave is going to be less severe. I do hope so, and probably it's be less severe. Now, the WHO chief scientist also has said that, and our own scientists have said that. But there is one missing information here. We didn't know about the devastation of the second wave until we got to know about the Delta. Right. So the Delta has swept the world. 80 countries are affected by this variant of concern. Now, we do not know which VOC might emerge anytime. And the more numbers get infected, more are the chances of emergence of variants of concern. We know Africa is afflicted now with a new variant, one C1.5, I think, C1.5, and then there is a mu, which is a variant of interest, and then there is epsilon, so far a variant of interest. We must provide for a possibility that some new variant may emerge. So our vigilance for the strains, see, the data that we share with the world on the strains and the genomics has to improve, has to increase. Now, all the states are not sharing equally. Let us understand that. And we may not know emergence in some state which is not doing enough research on this. So I would like to say we must leave one door open for some surprise.
Yeah, absolutely. We cannot lower our guard. But Dr. Vineeta, I basically also wanted to ask you about this gender gap in vaccination. Do you think it is prevalent in the society? Is less to do about planning and the administration of these doses? There's no problem there, but generally that's what's happened.
Yes, it has happened. We didn't utter the word patriarchy on this show, but that is what we needed to. Social conditioning, whichever way you want to say it, it is the patriarchal attitude. And what everybody has been saying, that if you keep the reproduction related, meaning pregnancy, delivery related admissions that women have to the hospitals and the remaining admissions, so everywhere men get preference. If the son is sick, he will get admitted and the daughter will get ignored. This is something about which there is, even when we say data are not good, we have enough data in various states and in various situations, that yes, women are always sidelined, sidetracked. They are the underprivileged, and I'm not surprised that even in the vaccination drive, they are underprivileged. One thing that, and I agree with Ranjana ji here, that if you look at how many men, young men have smartphones as against how many young women have smartphones, there is a gender gap there also. And this could be because there is no money and hence some is preferred, or that the young woman should not be talking to any Tom, Dick and Harry outside, this paranoia about women talking to somebody. All of this will contribute, and hence the COVID registration related difficulties that were mentioned will get accentuated with every point that I have also mentioned. So it gets added, and it nobody notices. You know very well that even in census data collection today, many people, especially from rural India, more from rural than the urban India, do tend to say how many of you live in the house. The answer is two, because there is a father and there is a son. And even if there is a wife and two daughters, they are not to be counted in the census unless you specifically ask the question. So if this is the attitude that society has and which we know exists, then is it a surprise that there is a gender gap in the vaccination? I'm glad that at least 40% are vaccinated and not something like 20. That's the
So
point.
there's no surprise that there is a gap here as well. Shouldn't have been, but that's the sad reality. So with this, we come to the end of this show. What one can take out, the main takeaway is that of course we cannot lower down our guard. Something that we cannot afford to do. Third wave is still around the corner. We need to be very careful. The pandemic is not over. The vaccination drive is underway. We are vaccinated more and more people, but still it is not over. Thanks so much for joining us, all of you. That's all we have in today's show. Thanks for watching.
Thank you.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.